At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9 FM, and we've got another great program for you, one that may make a few of you a little uncomfortable. But no, what I'm seriously talking about is our emotions and our stress levels and how they affect everything. And did you know that your emotional platform can affect your organ systems and predispose to disease processes? Also, reversely, that the other way can happen as well, that your organ systems, if they're not working the way they're supposed to, can also cause emotional expression to be altered and dampened. And we're going to get into that specifically. And when we go into the live stream today, right after the program on drtomroselle.com, that's how you find it. Make sure you follow me. It's Ageless Health live stream by yours truly. We're going to get into this much more in depth and specifically. But on the 18th, which is this coming Wednesday evening at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina, who's a doctor of naturopathic medicine, and Annabeth Goss, who's one of our top nutritionists in the practice, are going to do a night on emotional considerations and how they can be modified, if you will, by just slight dietary changes and energetic manipulation through acupuncture and so forth. It's a great program. I think you really need to be there. If you have anything that you're, that you've noticed about yourself, that you're flying off the handle, that anger a little piece, or you don't have any joy in anything anymore, or you're constantly in a bit of sadness, or, you were much more courageous if you were when you were younger, but now you're not, or you're worrying all the time about all kinds of stuff. Well, that has to do with different systems within your body, and they're going to put it together for you. But more importantly, some things that you can do to help yourself and make sure that, it goes straight up. And, we do a lot of different pieces of that puzzle when we deal with any patient, because health truly is neurological, biochemical, and emotional or decision-making. And so we want to show you how that really works. And this is a time that, if you got the tools to help yourself, you can make a difference on your day-to-day basis. And so that's what we want to do. We want to give you some of those tools and show you what you can do to make a difference. But let's talk a little bit about, your emotions and how they affect your body straight through to improve, but if you don't pay attention, to decrease your overall health situation. So let me start out by this. Patient goes to the doctor, and the doctor tells the patient, you're in trouble. You don't have much more time. And, if we treat you chemotherapeutically, or if we do radiation and so forth, might be able to give you a little bit of longer input, but you're going to feel lousy from the time we start to the time we end. I don't know about you, but I don't like that decision. I mean, this is the patient. In the back of their mind, they made a decision. Who gives you the right to tell me that my time is terminal? I don't think so. And suddenly the patient turns around. Conversely, if somebody has a problem that, they're not in a good place, but the doctor says, hey, listen, this thing, it's resolvable. You're going to go through some lumps and bumps, but if you do what we need to do, we're going to pull you out of it the other end. And the patient's all in on that. Not only do they get better, but they survive, and they're better than what they were before. Join us at this coming Wednesday evening. All you have to do to register is go to RoselleCare.com. That's ROSELLECARE.com, RoselleCare.com, and register and just make sure you come. Let us know if you can't make it if you do register. Or alternatively, 703-698-7117. That's 703-698-7117 and join us. But let's get into a little bit of this and what it really is all about and how you can identify something that said, this is not me. This is not the way I'm supposed to be. So, let's get into the organs and the emotions first so you can get an idea of what that really is. Some of you have bowel problems, right? You're constipated. And if you're not moving your bowels every day, you're holding on, my friends. But it also has an emotion, that large intestine, that large colon, that large bowel has emotions of frustration in a negativity, despair when it's negativity, and how about this one? Holding on to things. Yeah, that's why you're constipated. And your heart and your lungs. Well, those two things can lead to conflicts and delusions versus reality. Kind of interesting, right? And also the heart has to do with love. The lung has to do with resolving grief patterns. So sometimes if you have a problem with your lungs or your heart's beating the way it's not supposed to beat, you may have some, head-heart conflict. You may have something that you accept as really true, but in reality it's not. Small intestine has to do with the ability to concentrate mentally. It has to do with power and force. And if your small intestine is not working, you don't have good microbiome in it, your neurotransmitters aren't balanced the way they're supposed to, you can have the negative impact of all that. We talked a little bit about the heart, but the heart by itself has to do, if it's not working, it can be in a depressed situation. It could be loneliness. It could be willpower. It could be stubbornness. But the converse is true as well. We can, find ourselves in a lonely situation. Oh, I don't need anybody. I'm fine by myself. I don't like being around people. Well, one, it's going to cause you to be depressed, but it's also going to cause your heart to have symptoms as time goes on. Kind of curious, right? This is an interesting platform. How about your kidneys? Well, your kidneys have to do with your ability to have courage in things that you do. It has, and conversely, if it's not working, it could be very fearful. So it's like, okay, how are we doing this? Or maybe sometimes you don't have compassion for somebody else. That can be also a kidney. Gallbladder has to do with decision making. It's kind of interesting. We go out for lunch. I'll take my staff out and say, "Where do you want to go to lunch?" I don't know. You decide. What do you want to go to lunch? I don't know. You decide. We look at each other and say, "What's wrong with your gallbladder?" But it also, when it's backed up, those stone formations, you can have rage and you just fight fast. And that also goes into the liver with anger and hatefulness and so forth. All the organ systems express differently. Thyroid has to do with the ability to show affection. If your thyroid's not working, sometimes, leave me alone. I don't want to like you. You don't have to like me. That kind of stuff. A little bit of shyness sometimes. Stomach has to do with memory. It has to do with lack of courageousness, but that ties into your kidney because that has the same type of pattern. So it goes on and on and on. I just want to give you some basic thought processes on this because it's really interesting. And we've seen this for decades with our patients. When you look at the heart and the small intestine, they're yin yang to each other. You can see that there's a loss of vitality. There's a restlessness mentally that has to do with the heart and the gut. If your small intestine is not working, your mind is never settled. It's never calm. That gut feeling, if you will. You can't sleep. We have patients that wake up all the time. It's often that their heart and their small intestine are not working cooperatively with each other. You get those balanced out and things begin to go away. That profound sadness, even shame, by the way, has to do with the lungs and expression into the skin from the large intestine. If you look at your skin and you got lumps and bumps and blackness and things all over the place, that has to do often with the gut being toxic, polluted. And if you know that, you better take some action because otherwise those things are going to continue. They build up worse. Your skin looks ugly, but more importantly, is that underlying feeling of disappointment, the shamefulness of things that you did over a period of time. Those are real deals, and the ancients have known about it for thousands and thousands of years. So on the 18th, we're going to get into that a little bit, and I think you're going to be surprised that you can actually turn a lot of this around if you do it the right way. And, obviously, if you want any direct input and interpretation afterwards, you can always reach out to me at, drtomroselle.com or rosellecare.com. And I always make an attempt to get back to everybody. So we want to make sure that you have that capacity, you have the ability, you can turn things around. If you go to our website and you go to the B&B store, the iStore, the online store, we have a whole bunch of floor essences that we use. They're from a company out in Arizona that is called Lotus Way, and they have some very, very powerful products. And just not for anything, just check them out. But more importantly, you're going to get a whole lot of input. Let's talk about negativity of emotions and how they affect your organs. Negative emotions like anger and bitterness and grief and sadness, vulnerability, feeling of abandonment. I've been left alone, poor me. Everybody in my family's gone away. I can't hold on to any friends. Inflexibility. This is my point of view. This is how I believe. I'm not going to change from it. There's nothing you can say to make a difference. Self-esteem problems, feelings of rejection. Nobody likes me. Fear, terror, irritation, being timid, being confused. They all have to do with organ systems. That feeling of vulnerability, that feeling of abandonment, that's your small intestine. And anytime you have those emotions, you have to look at those other pieces. It holds on to the electrical field. It holds on to the vibrational platform that is part of that feeling of, I'm abandoned. Nobody likes me. So we're going to give you a whole bunch of things, with cancer particularly, and the bad diseases that are out there. There is so much that has to be supported from an emotional platform, fear and terror. You can't get better if you have a constant fear pattern because your body's an electrical field. It's like a magnet. Whatever you put out, you attract back to you. It's true, by the way. Whatever you put out is what you're going to experience. Whatever you put out, you're going to have as your experience, and it affects those organ systems. So when a patient comes in and we start thinking about, where they have the problem, is it in the lung? Has it gone other places? We're going to look at the potential, the possibility that they have a bad attitude about something, or they went into a negative attitude, or they were taught a negative attitude, or they didn't get over something, going back even to the point back in the day, that they lost their best friend because their father was military and they suddenly were transferred and they never saw that person again. And that grief of not seeing that person bothered them. And believe me, your body remembers neurologically the things that can take place. Do you know that sometimes your teeth are related to emotions, that you can lose a tooth simply because of the fact that the organ system that's related to that tooth, not just the heart, by the way. We know medicine has told us that if you have a tooth infection, it can affect your heart, which is true. But it's like the eye teeth have to do with liver and gallbladder. So all of a sudden, your liver's not working the way it should, and your eye teeth are going to begin to break down. Just going past that, the lungs have to do with the 12th and 13th tooth and the 5th, 4th, and 5th in the upper area and the lower areas. You can ask your dentist about these things. They have to do with emotional input as well. Kind of crazy, right? But it's the truth. We've seen it repetitively over and over and over again. Now, when a patient comes in and they're saying, hey, I have a headache, and I realize the headache is a result of something in their mouth, a tooth problem in their mouth, we can find out if that tooth and that organ system are involved. Often, and I'll treat the organ system and not the tooth, and the nerves that go to the tooth, and all of a sudden the pain presentation or the inflammation suddenly go away. if that's the case, wouldn't it be great to really understand how all this works? Well, we're going to show you a lot of that this Wednesday evening, but anything that I can do to kind of put the pattern together for you, you know that I'll do that for you. I'll make it happen. I'll show you what's going on. But more importantly, remember my book, Ageless Health, Health is a Do-It-Yourself program. This is about you having the tools to help yourself. That's the important part. So, there's a term that I love to use. It's called your inner smile. It's that happiness that's inside. That's it has to do with your heart and your organs to enhance, if you will, positive outlook, positive emotions. And heart and small intestine have to do with that primary feeling of love and joy and the like. And so when you have support there, you're feeling, oh my gosh, everything's just wonderful, right? You have the positive emotion of the stomach and the spleen and so forth. And that has to do with trust, openness, fairness. People who have that ability to express themselves, people who are open and willing to express themselves, those systems are working well. And if they can't, and sometimes they can't, they don't even know that they're not, they don't have control over it, is because they have a physiological problem. Now, remember, these organ systems also can be affected neurologically. And when they're affected neurologically, you have to fix the nervous system as well as the physiological platform of the organ. And then when you do that, all of a sudden, things change and they begin to turn around very rapidly. So when you get that, you got a problem, if you will, that just doesn't seem to want to budge, doesn't want to seem to go away, that's when you really have to start looking at the underlying triggering mechanisms of the emotional side of the triangle. Somebody who has repetitive respiratory problems, they've always got asthma, they always have respiratory allergies, you're going to see that in addition to that, when you talk to them privately, there's a grieving pattern that's going on that they've never been able to let go of. And that grieving pattern may be coming from something that they're holding on to. Remember, we said large intestine may have to do with that process, why constipation, that's called holding on to, right? You're not getting rid of. Kind of interesting stuff. But when you know that it can be fixed without taking drugs, without going on, the different suppressors and depressors, as I call them, this is your opportunity to figure out how to do that. And we're going to give you tools to show you. And really it comes down to all of us, right? It comes down to our willingness, our ability to really get involved in our own health. It's not about somebody else doing it to us. It's about us understanding that we really are in control. If we have the lower part of the body involved, right? And somebody comes in and said, I can't get pregnant, or my menstrual cycles are horrible, or I'm going through the worst menopause transition that could possibly anyone go through. Is there an emotion that's associated with that? You bet there is. And you have to begin to pull it apart. That emotion could simply be something that has to do with fear. It could be the loss of the energy, that we have as our core energy, our willingness to go and do, bravery, capacity to step up to the plate as well. And it reflects itself in those organ systems that are associated with that. You get rid of that piece, and all of a sudden life gets better. There was an interesting book, actually a couple of them. One written by a medical physician, a psychiatrist out of Australia. His name is Dr. John Diamond. I knew Dr. Diamond for many, many years. Brilliant man. Died maybe about 7-8 years ago. And the book that he wrote several, but the one that I would encourage you to read is Your Body Doesn't Lie. Your Body Doesn't Lie by Dr. John Diamond. I think that you'd really enjoy it. It's a short read. It's not bad. It's available all over the place still. But it'll give you an understanding of how the body really responds. There's another book out there by a guy called the 5-minute phobia cure. And I think that when you read that, just say, can I really get rid of my fears that quickly? And the truth of it is, yeah, you can. Roger Callahan's 5-minute phobia cure, uh, he developed this whole process back in the 1980s. And it's a notable example of how certain tapping at certain points within the body can address deep-seated fears and anxieties. You know, Roger was a member, one of the original members of the International College of Applied Kinesiology, and I had the privilege and the pleasure of knowing him and working with him, as a young doctor. Again, he's unfortunately one of the guys that are no longer with us, but you know, the pattern of the tapping patterns and acupuncture points to get rid of phobic responses is very significant. It works really, really well. So, a couple of reads for you, right? 5-minute phobia cure by Roger Callahan and Your Body Doesn't Lie by Dr. John Diamond. Good place to start. And we'll give you a couple others as time goes on. There's a kind of an expansion of the 5-minute phobia cure as well by two people, Dr. Sheldon Deal out of Arizona, and I can't remember the woman's name, but yes, I do. Her name is Jessica Vera, Vera. She's a PhD, and so there's a lot of people out there that really understand this. So wouldn't it be great? Wouldn't it be great if you can handle a lot of your emotional stuff without a ton of drugs, without, being told that, you're stuck with this for the rest of your life, when the truth of it is that you can totally reverse things very, very rapidly? I don't know about you, but I've used it in my own process as well. And, when you have a phobic pattern and, the complications, become wild, even to the point of, high risk comorbidities. What does that mean? It's called suicide. Uh, and you could reverse this and change it by yourself. Sure, there's some very, very few, a small, small percentage of a genetic problem but all these things, even the genetic problems, the brain is plastic. It can be remolded. It can be readapted. So what do you got to lose except to learn a whole bunch of stuff about this? And that's what we're going to do this Wednesday evening. So join us and we'll see what we can do to give you tools, if you will, particularly dietary tools and energetic tools to be able to shift and change and turn things around. But if I can help you, you can find me really, really quickly simply by going to drtomroselle.com and send me a note that way, or go to rosellecare.com and join us and come in. I want to encourage all of you, if you've never been to the Roselle Center in Fairfax, there's a group of docs who are brilliant, and they work together as a team, from the nutrition department to the applied kinesiological chiropractic department to the acupuncture department, and they look at things structurally, neurologically, biochemically, as well as emotionally. And you have to truly, if you want to resolve something, you have to go to all those platforms and begin to put them together the right way as a group, and to give you, more importantly, the tools to be able to help yourself. The 5-minute phobia cure, remember I said, check that out. Roger Callahan, Your Body Doesn't Lie. Those are two great reads. Go get them. It's worth reading them multiple times. And then follow the bibliography on them and go and check things out. I think you're going to be really, really, really impressed of once you start it, what takes place, what happens, the balancing of emotions, for the first time, maybe ever. We're coming up to the point of the program where we're going to flip over to the live stream, and we're going to continue this thought process for another half hour or so and give you some more information. Remember, you can find all of our past live streams on drtomroselle.com or at rosellecare.com, but go to drtomroselle.com because both websites lead one to the other. Remember, I'm here every Sunday, giving you the best of the best information as we possibly can. You deserve it. You need to be able to take control of your body. Your health is in your hands, and you shouldn't give it up to anybody else. Remember, I love you all. Have a great Sunday. Follow me now. Let's go do it.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.